Dear Chair, dear audience, my name is Mirjam Kisgergely, and the title of my thesis is New Insights into the Accuracy of Fixed Dentures. I'm a first-year PhD student and a dentist at the Department of Prosthodontics at Semmelweis University. My supervisor is Gellért Jós Kovács, and my scientific methodology supervisor is Mirjam. My vision is to provide longer-lasting dental restorations to patients, and my mission is to explore the ways to produce more accurate dental prostheses. Currently, I have 2 ongoing projects, and my main goal is to compare different types of dental milling machines. The title of my first project is Comparing the Accuracy of Dental Milling Machines in Fabricating Fixed Dentures. There was a study in 2007 in which they found that 94% of crowns had poor marginal fit, which is predisposing to failure. This means that 94% of these teeth restored with crowns are more prone to develop, for example, caries or periodontal diseases, which with time can lead to tooth loss and eventually even edentulousness. When we want to make dental restorations, we always have to consider quite a few aspects, and one of the most important is accuracy. We always have to determine the appropriate dimensions of a prosthesis to be able to make long-lasting ones, and this clinically accepted accuracy is around 100 micrometers. So how can we make these crowns? In an annual report of 2013, we can see that 75 to 80% of crowns were still made manually and only the rest by computer-aided production. The problem with this is that these handmade crowns mean a slower production. It is unrepeatable because the technician designs it by hand, which can lead to human risk factors such as inaccuracy. So what is the other option? Is the computer-aided design and manufacturing. It means a faster production, it is repeatable because all the data are stored on computers, and it is also accurate. The CAD/CAM systems can be divided into 2 subgroups. One of them is the in-lab, which means that we still have to send the work to the dental technicians. Therefore, it requires multiple dental appointments, but it is considered accurate. The other one is the so-called chairside system, which means that everything happens at the dental clinic. It also allows us the concept of same-day dentistry, which means that the patient comes in and can leave on the same day with the final restoration. The question arises in this case whether we can make accurate restorations with this fast production. Therefore, our aim is to compare the accuracy of dental milling machines in fabricating fixed dentures. Our clinical question is that how accurate chairside milling machines are in fabricating fixed dentures, and we use the PICO framework, where the population is milled single-unit restorations. The intervention is different chairside milling machines, and the comparator is different lap-side ones, and our outcome is accuracy. The hypothesis is that chairside milling machines can produce fixed restorations as accurate as lap-side milling machines. Our clinical and research implication is to provide patients with CAD/CAM fixed dentures milled with the highest accuracy. After finalizing my search key, I've downloaded the articles from 4 databases, which resulted in a little above 13,000 records. After the duplicate removal, 8,600 remained. After the title and abstract selection, I have 326 articles. Currently, I'm at the phase of full text selection, with the deadline being at the beginning of January. The title of my second project is Comparing the Accuracy of Dental Milling Machines in Fabricating Crowns, which is an in vitro study. During our everyday practice as dentists, when we want to make restorations, we always have, when a patient comes in with a problem, we always have to consider making temporary restorations before the final one. Why is that? Because other dental treatments are sometimes needed, or aesthetic problems can occur if the frontal region is affected, or the chewing function needs to be restored. As I've mentioned before, when we want to make restorations digitally, we have 2 main ways. One is the chair side, and the other is the lap side way. The advantage of the chair side is that the restoration can be ready immediately, while for the lap side one, we have to wait approximately 1 week. The problem in this case is that we do not know for sure whether this fast production or the simpler software of the chairside system allows us to fabricate restorations that are the same as the original design, thus being accurate. Therefore, we aim to observe the internal surface accuracy of the lab side and the chairside milled restorations. Our clinical question is that how accurate chairside milling machines are in fabricating crowns, and we use the PICO framework with the population being milled crowns. The intervention is a chairside milling machine, and we compare it to a lap-side one, and the outcome is accuracy and time. And the hypothesis is that chairside milling machines can produce crowns as accurate as lap-side milling machine, and the implication is the same as was before, to provide patients with CAD/CAM fixed dentures milled with the highest accuracy. Here you can see that the method of this study starts with the virtually designed restoration and upper central incisor. We will send this data to the chairside and the lap-side milling machine and then mill it with each. After the fabrication is done, we will get these crowns you can see in the pictures. We will use a scanner to digitalize them, allowing us to compare them to the original design. And this comparison will be made by superimposing the two data. Here you can see our outcome, which is accuracy. It has two main components. One is trueness, which means that we project the STLs of the group's elements onto the reference one by one, and the program will give us the difference for each. Besides trueness, we also have precision, which includes measurements within a group. As an evaluation, the program will give us values such as average, root mean square, or standard deviation. As for secondary outcomes, we would like to measure the time that is needed for the milling procedure, and also the amount and type of waste material that is generated by the process. Let me finish my presentation with a quote from Carl Sagan, that somewhere something incredible is waiting to be known. Thank you for your kind attention.
Thank you for your presentation. Okay, ladies first.
Congratulations for your interesting presentation. And my question is regarding your second project. So do you only plan to compare crowns to the original design?
Thank you for your question. Actually, we also like to see how repeatable the making is. Therefore, after the scanning, we not only want to compare the crowns to the original design, but to each other as well. Therefore, we can see the reproducibility of the machining.
Thank you for your answer.
Okay, other question? Okay, Abel.
Thank you for your presentation. I have a question about your second project. Which design software would you use to design the original shape, the lab one or the chairside one? Does it affect somehow the results?
It can affect the result because the chairside software, as I've mentioned, is much simpler than the lap-side one. In this case, we thought about using the chairside one and then mill it with each the lap-side and the chairside milling machine.
Thank you.
Thank you for your question.
Other questions from the audience? If not, oh, okay, Anna, sorry.
Congratulations on your presentation. I would like to ask that what do you think, what is the main difference between chairside and lap-side CAD/CAM machines?
Thank you for your question. I would say that chairside milling machines are made for fast production. Therefore, they usually have, for example, more milling burrs that can work alongside each other, so that a chairside milling machine can produce a crown, for example, under 10 minutes or around it. So it is made for a faster production, basically. And also, usually you can make smaller restorations using it, and only with the lap side you can make up for more than 5 unit restorations, for example.
Thank you.
Thank you for your question.
Other questions? Okay, I have a question. for the second topic at first. Which program do you use or plan to use to the analysis or to the...
The Geomagic Control X program.
Okay, thank you. And for the first project, you showed some data from 2013, the handmade and
yes.
CAD/CAM CRAN. How does altered this data in the last 10, 15 years?
It changed a bit towards the digital way, but we still make crowns and restorations manually. So it's leaning towards the digital way nowadays. I mean, not in ratio, but more and more restorations are made digitally. It is accelerating these days, but I think the bigger part is still made manually.
It's Hungary or in the worldwide?
Worldwide.
Worldwide. Mm-hmm. And the Hungary?
Hungary, I would say that manually is the most common way, but we would need an exact search for that.
Mm-hmm.